Welcome to the virtual seminar Measuring What Matters, Advancing Early Childhood Development Monitoring in the Americas, launch of the Global Scales of Early Childhood Development for the Americas. This event is jointly organized by the Pan American Health Organization and the Inter-American Development Bank. My name is Paola Caporal, International Consultant in Child Health for PAHO, and together with Dr. Oscar San Roman, International Consultant for PAHO in Adolescent Health, I have the pleasure of serving as a co-moderator in this important regional launch. Before we begin, I would like to remind you that we have simultaneous interpretation in English, Spanish, and Portuguese, and you can choose the language of your preference by clicking on the interpretation icon at the bottom of the screen. Antes de comenzar, quisiera recordar que de todas las... Today, we launch officially the program of scales, and you can, and this is an important step towards the development or in the region, and we welcome you to, we welcome our colleagues from Bahamas, Belize, El Salvador, Argentina, Peru, Suriname, Uruguay, and among other countries of our region. In order to start this event, I would like to invite Dr. Barbosa to start his presentation. He has, well, we will continue with the agenda, and then if it becomes possible, we will hear Dr. Barbosa's words. We will now listen to the welcoming words from our other institutions. First of all, Pablo Ibarran of the IDB. Dr. Ibarran, you have the floor. Thank you very much, Paula, and thank you all. Good morning. For me, it's a great pleasure to start this session. We heard some words of Dr. Barbosa, and I also agree with Dr. James Fitzgerald. I agreed, Dr. Fitzgerald, and we have had the pleasure of working together before. And today we're looking at an agenda that is of great relevance at global and regional level, which is to have um, trustworthy tools, easy to use, and also of accessible prices to measure the different parameters for in early childhood, because we have to measure what really matters. And this is why today we have a large participation of Latin American and the Caribbean. Because you cannot transform what you cannot measure, and what we look for is that each child, without mattering where it is born, can reach its full potential. And as we do with with the physical growth and development, we do the same also for mental issues. And so under the leadership of WHO, we have several experts, both at world level and regional level, and also from the IDB and PAHO. And this shows you that if we are able to put together our efforts, we can offer solutions that are more solid, more sustainable, and to improve the policies of childhood development, because they are the most important stepping stone to improve the development rate of societies. The IDB is very much committed to the early childhood. We are supporting the countries in the region since 15 years ago with programs for childhood development of great scale and outreach, and also with programs for accompanying families in this endeavor. We strengthen institutions and improve governance. And this is why we invest in strategies of scale measurement and in the development, for the development of children of both sexes. In 2014, we were part of the Discord group of the Global Child Development Group that sets the first efforts that put together the first steps for this effort. And the programs in Colombia and Ecuador, for example, have been very important for building this tool. And we have also made progress in the tools of this program, and we also have translated into Spanish and Portuguese the different documents for the region. And here I want to thank the staff of the different organizations involved because without your help, this tool would not have been possible. At the IDB, it's a great pleasure and an honor to be able to help in this effort, and that is so important for our region and for the world. Today, we're launching a global, free of charge, but validated tool that will help us to have these curves of child development together with the stature and weight scales that are so important to measure the development of children. From the IDB, we'll continue working on that in order to measure the development in children below 5 years of age. We are talking to several countries in the region to support the pilot programs of the IDB of this program in the region. I would like to thank our partners and our colleagues in the region, especially the WHO, PAHO, UNICEF, World Bank, and several countries that have participated in this effort. I invite you to profit from this meeting in order to learn more about these efforts because the getting together is starting, working together is progress, and reaching the progress and reaching our goals is success. And this helps all children to develop in the best way possible. Thank you, Dr. Ibarran, for your words. And now we will listen to Dr. James Fitzgerald from PAHO, the informatics department. Thank you, Paula, and all those who are with us
To
today at this
welcome to
important
this
event.
session all the representatives from ministries of health across the region of the Americas who really have shown the commitment in recent years to broader issues to integrate early childhood development into primary health care. And of course, to my friend and colleague, Pablo in the IDB, a very good morning to you. And a special note of thanks to the IDB for your continuous support, your collaboration, your friendship as we work together in really moving forward to translate this instrument into a powerful policy instrument enabling countries to move towards implementation and operationalizing child development. And to all our colleagues from WHO, and of course, the team here at PAHO, very good morning also to you, and thank you for your wonderful efforts in making this a reality, translating this global instrument into a powerful tool that can be used across the Americas. Today really marks a significant milestone in operationalizing child development monitoring across the region of the Americas. The launch of this Spanish version of the GSED package fills a critical gap that we've perceived in recent years. It really provides validated, accessible tools for countries to measure, understand, and respond to early childhood development needs. As an organization, we see this as really a powerful instrument to be able to translate the policy commitments that countries are making into concrete action at the service provision level, enabling countries to move from commitment into implementation. The tool aligns with our broader efforts to integrate early childhood development into our strategy on primary health care, a strategy that we're also working very closely with our colleagues in the IDB and the World Bank through the Alliance for Primary Health Care, and of course with all our member states. But critical to this is the life course approach the integration of needs across that life course, and its linkages with universal health strategies. We are particularly proud of the collaborative processes that has led us to today in the development of this Spanish adaptation, in working with our colleagues in WHO and with IDB and our experts and country partners. But it just isn't about translation of a document. It's really around adaptation of this instrument to the regional context in the Americas, a region that is marked by enormous inequities in access to health, with linguistic, culture, and system level challenges and alignments that require adaptable tools across very, very diverse settings. The tool complements existing tools like the Pocketbook of Primary Healthcare for Children and Adolescents. And this Pocketbook is really going to be a powerful instrument for population level monitoring, programmatic evaluation, integration of care at the primary care level throughout our health systems. Looking ahead, and we are already looking ahead, we're looking forward to the GSED 2.0 tool, which is currently under development with WHO-led research to establish normative standards that we can anticipate further integration into individual child health assessments during routine visits. Our region, the region of the Americas, is really playing a leadership and key role in this process, with PAHO's active participation and engagement and collaboration with WHO and our research teams in Chile, Brazil, the United States, and Mexico. So like Pablo, let me really acknowledge the wonderful work that has gone on to date with our technical teams here at PAHO, jointly with the IDB, at WHO, at the national level. All of us, you, the technical teams, are the engine behind this achievement. But it's really the countries now that we need to engage and ensure the level of commitment in the application of these tools within health systems that are highly complex, highly diverse, and unfortunately continue to produce enormous disparities and inequities, both in access and coverage and health outcomes, including in child development. We remain committed to supporting you, the countries, in training, in the integration and the monitoring and the application of this tool, so that it just doesn't sit on a shelf, but it actively informs programs and policies. Because ultimately, investing in early childhood development and in measuring what matters is investing in human capital and our equity agenda in this region. Thank you very much, Paolo.
Thank you very much, Dr. Fitzgerald. Now we are ready to move to Dr. Jarbas Barbosa welcoming. Brenda.
Distinguished participants, colleagues, and partners, good morning. It's a pleasure to welcome you to this important event, Measuring What Matters, Advancing Early Childhood Development Monitoring in the Americas, and to the official regional launch of the Global Scales for Early Development, GSED. I would like to thank the Inter-American Development Bank, IDB, our co-host and strategic partner, for its unwavering commitment to early childhood. At PAHO, we have long recognized that investing in early childhood is one of the most impactful ways to reduce inequalities, break cycles of poverty, and build healthier, more resilient societies. The early years are critical to shaping the future. This is when rapid brain development takes place, when relationships and environments leave lasting imprints, and when the foundation for a healthy, fulfilling life is built. Across our region, countries have shown leadership through multi-sectoral early childhood initiatives. Programs such as Chile Cresce Contigo, De Cero a Siempre in Colombia, and Criança Feliz in Brazil demonstrate what is possible when we prioritize nurturing care from the start. A shared feature of these programs is the integration of early childhood development within health systems, particularly primary health care. This ensures continuity of care and allows services to better support children and families throughout the different stages of life, adapting to their evolving needs. Still, to this day, we have lacked a tool to reliably measure how young children, especially those under 36 months, are developing. This has limited our ability to act on what matters most. The GSED tool marks a milestone in assessing early childhood development holistically. It is the first validated, standardized instrument for measuring the development of children up to 36 months of age. It provides a common language within and across countries for the generation of evidence to guide policies, improve programs and services, and ensure accountability. It helps align services and programs with children's developmental trajectories and strengthens our ability to provide timely, integrated, and equitable care. Now I'll switch to Spanish. Colegas, la traducción del GSED al español es fruto del trabajo conjunto entre la Organización Panamericana de Salud y el
This effort is the fruit of a joint commitment of different countries and of the regional cooperation, and we understand the early childhood development as a collective endeavor. And each child should have the same opportunities to learn, and it's very important to monitor the first years because this gives us tells us about the path for integrated measures to accompany children in their development. From PAHO, we support the countries in the implementation of this tool. We strengthen the capacities and we identify the gaps and we improve planning where it is needed. To measure early childhood development, it's truly important because every child is important since its birth. Thank you very much. Thank you very much, Dr. Barbosa, for establishing the groundwork for our discussions. I now give the floor to Dr. San Roman. It's a pleasure to share with you, my role as a moderator today. And now we will have a brief explanation about the context of early childhood development as a key factor. And I invite Dr. Anessa Calavera from PAHO. Go ahead, doctor.
Good morning, everyone. Waiting for the slides. All right. Hello, everyone. Can you all see the slides? Perfect. Wonderful. Thank you, everyone. And it's with great pleasure that we go into the content of the Global Skills for Early Development package and what the whole vision for the project was. It's really exciting for me to be able to share this package in Spanish and to having been able to collaborate with colleagues from the region to make this happen. It's a true success for really the scale up of the ECD measurement agenda. We know how important the early years are and how the brain grows in the first years of life. And so by the first 4 years of life, 90% of the brain is formed, even though connections keep growing. Yes, next slide, please. Thank you. The early years are very critical and they lay the foundation for future development, for all the contribution that the child and the person can do in many different ways to the society later on. And so this is really a window of opportunity that we have in the early years where children should really be put in a position to thrive so that they can continue growing to the best of their potential. Currently, one of the gaps that has been identified in the last few years was really the challenge of measuring child development in these early years. There were measures for later on where the cognition and the developmental domains are more easy to measure. And where the child, the interaction with the child also has been studied, longer. But this gap in the early years where actually measurement is so critical to be able to then develop interventions, programs to identify where the vulnerabilities are, especially at population level, was always a gap. The way historically that child development was measured was through proxies, because it was thought that we could not actually measure child development directly. And so stunting was used as a proxy, or, for example, poverty, which obviously, as we know, as part of the nurturing care framework, they are factors that influence development, but they really don't correlate as strongly as we thought they did. Next slide. I sit in Geneva in our headquarters of the World Health Organization, where we have a unit that focuses on brain health across the life course. So we start from the early years, and we've been looking into how do we look at child development, exactly like I said, across the life course, right? So how do we optimize the windows of opportunities that we have across the life course? And what are the determinants that are most important for brain health? So as part of the work that we're doing, as part of the broader nurturing care framework that was launched years ago, we know how important different pillars are for the brain to develop as best as it can. And it looks at the environment. So we need a healthy environment. We need obviously physical health. We need safety and security. We need opportunities for learning that is also early on. And then we need access to quality services. Next slide. So the context is important, and so in terms of the brain health in the early years, but also what is important for measurement to understand is really also the what contributes to the development of the child, and how can we account for that when we measure child development. So looking at something that could be truly globally applicable, while understanding that there are environmental and contextual differences. Next slide. Then looking at the prediction of what we are considering. So as I mentioned, there are the different domains of that are important, different areas that are important for child development, and we need to make sure that interventions address all of them. But at the same time, we also need to know what are the factors that have a predictive impact on child development. Next slide. And all of this really brought us to see that we really needed to develop a tool that could be globally relevant and at the same time predictive of later development, which was something that was not available. Next slide. So this all came about also in a context of global policies that
Esto se ve en un contexto de políticas globales
have started to support child development. And so we had the Sustainable Development Goals that, after the first round of development goals really finally included child development and looking at children that are developmentally on track. However, given that an indicator and a measure was not available for the youngest children, there was a definite gap there. So how would governments be able to report on this if there's no measure for it? We have the ECDI 2030 for the 24 months old and older, but there was really a gap for the youngest kids. Then the nurturing care framework, as I mentioned, it's something that massively brought innovation to the field and really brought together a multi-sectoral approach that we've always been advocating for, but really showed how important that is for child development. However, if we want to look at the impact of programs, again, we didn't have a measure to really look at whether interventions were having the effect we were hoping they were having. And then lastly, and this is part of the ongoing work that my colleagues talk about, the GSED 2.0, it's also looking at a similar metrics that looks at individual children. So with nurturing care framework programs and sustainable development goals and policies, we're looking at population level, but always we need to remember that we also need to be able to support individual children with neurodevelopmental impairment. So one of the basically key aspects of why we started embarking in this project is that if we don't have data, it feels like there is no problem and then no action can be taken. Next slide. So yes, we need better instruments that we're lacking. So there are some, the science tells us what are the characteristics that good instruments should have. And so obviously they have strong psychometric properties. They need to be feasible and implementable, so cheap and free and easy to administer at scale. They need to have an easy way to standardize and understand the scores and what do the score mean, and then really be able to help us understand early childhood development. So looking at the impact, looking at tracking and monitoring development over time, and all the different use cases. Next slide. So the first step is having a framework, which we draw on existing ones. We drew on existing ones, and we further developed them to make sure that we had a study design that allowed us to create an instrument with the characteristics that that we mentioned. But generation of the framework was not all that there is, because then the data needs to be used. Next slide. So this is why the GSED came about, really to address a gap. Next slide. Criteria for measurement. I know we're a bit behind schedule, so I'm not going to go into the details. This is more technical. We can share more information as needed for those who are interested, but this is a bit more about the science of developing a tool. But basically, we want to have a tool that we can trust in terms of the information that is giving us, and that is its implementation aspects are really feasible and implementable at scale. Next slide. We won't play the video now because we're a bit behind schedule, but yeah, we will share the slides and we will share the link of the video in the chat to give you an overview of what the tool is, but my colleague will take us through the details. Thank you, everybody. And this is just to give you a sense that really the tool has been used quite widely already. We have lots of different translations, even though the package has not fully been published in multiple languages, but they are available. But it's great. It's going to be great to see how this package in Spanish will even increase in the region its uptake. Over.
Thank you, Doctor, for highlighting the scientific and political relevance of having better development of early children development. I would like to give the go-ahead to Dr. Paula Caporal. She's going to discuss GSED package in Spanish. She's going to discuss the cases of use and access. Thank you, Dr. Cabrera, for showing how relevant it is to evaluate children's evolution, the need of that tool as well. I don't know if you're able to see my screen properly. Yes. Okay. So I wanted to mention that GSED was developed by WHO, and it includes 2 actions that were validated. This was performed in order to evaluate children's development or early development for minors over 3 years old. It includes questionnaires. It includes a technical report on building this instrument. It has 2 guides that will be implemented and others that will be scored. For implementing, we have 2 questionnaires. One is a short one. It is related to the reports of the caregivers, and the other one is a long questionnaire that uses direct assessment. We have score D. The domains include automotor development, cognitive, and social emotional development. But in the end, all of this is a final score. From WHO, along with IDB, we have translated all the package to Spanish. It has 9 documents. It includes short questionnaires, long questionnaires, and it includes the transversal documents. All of these are going to be able to be downloaded for free through our website. For creating GSED, we have used several cases. First, we have gathered a group of experts when it comes to children's development and research. They have developed a conceptual framework. We have started a collection of data with a database of items. We have more than 2,275 items coming from 31 countries. But beyond the framework, in its origin, GSED represented the largest database that was analyzed. We analyzed these database items by measuring all of the actions between the instruments, and after applying these statistic models, we measured evolution through different domains, which is T-score. We perform iteration based on the viability of its application and coverage per domain. For those who are interested and would like further detailed description, you're going to be able to find this in the technical report in our website. This instrument was duly validated in 7 countries, and assessment of all the psychometric features were surpassed. This includes reliability with correlations that are statistically meaningful, like, for example, the socioeconomic status and growth. We have shown a correlation with the Bailey scale and the qualitative data that actually have shown a proper validity of the content. The use required for the tool is minimum. GSED would be unidimensional. Beyond measuring diverse components, this would be measured in a holistic way or integral way. And what we do is compare score D with a single domain that includes or represents children's development. Score D would be a summary score. It includes a number of early children development, and it measures how they are evolving by combining physical features, communication features as well, and this includes a single number that would represent how are they developing. This includes the score of children that would be increasing with age, and we monitor children's development by using growth graphs. We have an interval scale that could be compared with centimeters. This is a measurement unit. You know that we use centimeters for height, and we use score D for children's development. This enables having comparison between children of the same age, different ages, and countries as well. We are going to be able to have monitoring of changes. We could notice that this could be similar to charts that we use for height or weight. D score would be based on the skill of children, not in age. With that, I would like to say that we are tracking children's skills regardless of their age. This enables us to know how are they growing. The scale has a constant unit. So if there's a difference in skills, it would entail the same unit for all the measurement. For example, 10 centimeters difference would be the same measurement, regardless if the children is tall or short. The short questionnaire is performed for the caregivers or caretakers of the children or tutors. Each tutor would respond 30 or 50 items with yes or no questions. It also has audiovisual material that could help them. We also performed this test between 15 and 20 minutes. The long questionnaire could take among 30 minutes or an hour, and the long questionnaire evaluates the children directly. GSED is administered to be administered through GSED, and we could use it in paper. This application was performed to facilitate measurement. It's of quite simple use, it's free, and it's merely an interface. What I would like to say with this is that the data is sent to our servers, and application would be available in Google Play, and it's available by request, and in a couple of months will be available through a website discharge or download. The whole package will be available in Spanish and Portuguese in PAHO website. There's a QR here. If you scan on it, you're going to be able to access, and we're going to have a link on the chat box here. GSED materials are available on the website. If there's technical support required, you can request it through GSED at who.int. Whether you need access or training, this is where you could request it. With regards to adapting the tool, I want to highlight that in case we need it, when we say that GSED is transculturally valued, we want to say that this has been tested with different contexts, different countries, in a way that the activities that could be applicable, this could be applied to without having cultural changes. This means that the instrument is contemplating diversity in context, and they want to measure children's development globally. Therefore, we don't recommend having extended adaptations with the items. We also have different training packages. For short form, we have some options online. We have auto managing options that will be available for PAHO, and we have a face-to-face setting, which is something that you can organize through the email that I just mentioned. Regarding the long formulary or form, there are trainings, whether hybrid or face-to-face training, that you can request through WHO or through the email. When it comes to the associated cost to GSED use, GSED will be open access. Regardless of having any tool, we're always going to have additional cost in its implementation. So we know that the GSED cost, it's even minor than other tools that are available. What do we expect in the future for GSED? Well, we have a form for home, which is measured to check children's development, while the index for first infant will be applicable for 24 and 25 months. And the household form is solid. but we know that its accuracy is minor. We know that the level of accuracy is something that we can compare with SDI 2030, with other surveys, as well as the infrastructure. We have introduced a package, and we know that it's going to be available in Spanish and in Portuguese with our website from PAHO. Furthermore, we are developing tests. We are going to be able to adjust the difficulties in real time according to the responses of the caregivers, and we will be adapting assessments according how viable it is. Beyond improving accuracy, it enables us to administer a form in a shorter way, and I believe that we could administer in 9 or 12 minutes after 30 to 1 hour. We are performing a study which is called GSED 2.0, and we are generating standards, worldwide standards, in a region which is Brazil, Chile, and the US. We are collaborating with the work, and we're going to be happy to listen the next speakers or researchers in these panels. We are performing a harmonization of this tool with UNICEF in order to measure continuously the evolution of 5-year-old children. The objective of GSED 2.0 is to perform this and do the adjustment according for children that are turning. And we are guaranteeing the use of the tool to detect this individually for children of 1 to 3 year old, according to comparison to 5-year-old. So if we want to choose a form or either the other, we can use the evaluation and the unit of preferred administration on its capacity and administration. We believe that this is going to help us track trajectories for groups of children throughout time, and evaluate the benefits of those policies worldwide. GSET is going to be tested to identify development of children individually for purposes. If this work is ongoing, for the moment on GSET, we cannot use this individually. And we cannot have independent use. And finally, I am going to be able to hear the document as well. Thank you. Thank you, Doctor, for this introduction. And as was mentioned, we are going to start with the first panel. This is the specialist on children's evolution, and she works for Working Market for the IDB. Thank you, Oscar. And good morning, everyone. I would like to welcome all of the panelists for them to start hearing about the implementation of GSED 2.0 in their countries. We would like to contribute to the development of the tool individually with regards to primary care, and I would like to welcome the doctor of Pontificia Universidad Católica de Chile. She is professor of pediatrics department in the University of Sao Paulo, Brazil, and she is responsible for children's development in Universidad Peruana Cayetano Heredia de Peru. And I would like to welcome Susan Martin Hetz. She will be in charge of the PEDS department in University of California in San Francisco as well. Yes. Good morning, everybody. I don't know if we have everyone on the screen at the moment. Yes. All right. Thank you. Paula, I would like to start with you. What strategies did you use to regulate GSED or implement GSED? Yes, thank you, Marta. It's a pleasure to greet you. I have met you for a long time now, and I am very happy because for the ones that we love the early children development, this is not only about mental health, this is also related to the social evolution of each country. That's why this is extremely important to have good metrics. The question is quite interesting because since this is a multi-centric study where we have committed countries, it's important to standardize the process, and it is important to have good quality measurements. This study has two phases. One is a pilot and the other one is the main study, where we're going to compile the information that in the end is going to contribute to establish a distribution of the indicator. That's why it is critical to standardize in the pilot phase. This was critical for our team. We started with reading the research protocol, which is really important, and we were able to identify aspects that are non-negotiables. And we started a second phase, which were the ones that we could actually perform. Within the work that we needed to do was applying the instruments that were related to including or excluding samples and direct analysis with children, where we have a fast analysis of anemia. We were doing anthropometric monitoring in the short and long version of the questionnaire. So it is important to consider that the non-negotiables include training. We had training with the operating manuals that were provided by the WHO forms for us to use this on the field. And GSET training was fundamental. We had training with Michelle Perez. She helped us a lot in this. This implies having a coordinating work with experts to be suitable and perform this in the best way. This process was held by two people in our team that were trained in the US. We had a big group of us. They were trained actually to be trainers, and in this study phase, they were able to do a cascading to have suitable personnel to implement training as well as the same reliability level for its application in the field. It's important to mention that training is not only important, we need to consider how good are we going to have our readings. This depends, of course, on what happens on the field. The WHO team has gathered professionals to share our doubts, and this has enabled us to do measurements. We were able to identify some areas of improvement related to local context, for example, with regards to GSED. And another milestone includes recycling on a study from Chile. We have actually learned our doubts. They observed how we were doing work, and they gave us some observations. This is not a process that is actually finishing. We are maintaining this throughout all our research, and this requires something that I want to mention, and with this I'm going to close my presentation. This includes leadership from the focal team. And I wanted to mention that this has been collaborative leadership. There was lots of respect involved, and we were able to show how different we are, but we were able to stay focused on the objective of the project. I believe that this has been beautiful for us as a team to generate a learning community that it does not include only providing information, but also learning on the research process and what this entails. And just to mention something else, it is relevant to standardized follow-up control of all ethical considerations in our research, which are not only in its application, but also on the written consent and other elements. Of course, we are quite demanding, but this is something that has came up, and it is important to mention that this is within the standardization process. That's what I wanted to mention. Thank you. Thank you, Paula, for all the remarks, for mentioning how rigorous it is, and standardization should be something that should accompany us throughout this work. Suzanne, I would like to welcome you. She's joining us from San Francisco to talk a little bit more about how relevant we have our adapting process. And we wanted to see how GSED is working in this context. Thank you.
Thank you very much. And thank you for having me here. I'm excited to join you on this important meeting. I think we were privileged in the US site to have received the almost final draft of the Spanish language GSED tools. And so when we were working on translation, we really didn't find that difficult at all. There were very few pieces of the tool, maybe a few words that needed additional work to fit with our local language use. And then we did have that approved through the WHO and PAHO to be sure that we weren't changing anything about the use of the GSED tool by making those very small changes. To the point that was made earlier about the tool being developed and validated globally, we found that we didn't actually have to make any adaptations. There was nothing that we requested that needed adaptation in the tool for our context, although it had not been developed or validated in the US prior to that. And that's really wonderful. That's not always true for developmental tools, as you know. And then for training is a big piece of the puzzle for developmental evaluation and developmental assessment globally, because it can be expensive and it can require a lot of a large skilled group of assessors. And we actually found that the training of our non-specialist, non-clinician team actually was quite easy compared to other tools that we've used for developmental evaluations and research in the past. It was completed by the WHO team in PAHO as well, and jointly with the Chile team, as Dr. Paula just mentioned, that they came to San Francisco and we were all trained together. And similar to in Chile, we have two trainers that were certified as two of the assessors that are also certified as trainers. So we're able to do a cascading training of trainers kind of model and continue to train new assessors locally, which has been a wonderful asset. So we don't have to reach out to the central team anymore for that, that process. In our setting, we're completing both the caregiver report short form and through an interview, and the direct assessment long form with children, similar to what Dr. Paula just described. We're completing the same research study that they are. And one consideration in our setting is that we sometimes have discordant language use between the child and the parent, where in some cases a caregiver may be more comfortable answering interview questions about their child's development in English, but the child has only ever been exposed to Spanish in the home or very rarely exposed to English at all. And so we really want to be doing the assessment in Spanish for that child. And what's nice about the model of the GSED is that we're able to complete the short form in English in its entirety when the family is most comfortable with that language. And then we're able to do the assessment in Spanish, which is the primary language of the child. And we found that that has worked very well in our context, and think in a linguistically and culturally diverse setting like the San Francisco Bay Area, that process will be very helpful to us in other language groups as well over time. Thank you.
Thank you, Susan. Great. I'm very happy to hear that the tool was easy to adapt, and that you didn't have to train people for a long time. And so the development of a global tool is really achieving its purpose. This is very good news. I wanted to go over to Peru. I wanted to ask you about the implementation of this tool in Peru, and what your recommendations would be to other countries in the region that would like to use the tool. Good morning, everybody. I'm very happy to be able to tell you about our experience with GSED long forum here in Peru. I will summarize this in 7 points. Flexibility is the first point. To apply GSED and the field requires quite a lot of flexibility, because sometimes we interviewed people at the market, sometimes at home with floors, with earthen floors or animals around, and several members of the family around, and various interruptions. So this became quite complicated because we had to manage all the factors in each environment. And the second point would be time and logistics. We saw that with some children, the GSET it took a longer time than with others. So we had to work on realistic time frames in order not to miss important points such as the introduction or the establishment of a trust relationship with a parent. In the rural settings, the toys employed by GSET were very interesting for the children, and the children wanted to keep them. So we we established a rule to take additional toys to distribute. And also the sex of the advisor, the evaluator. Well, some children felt happier with women than men, so we had to take into account the cultural aspect. And the interaction with families was also fundamental. First of all, with the caregivers, we have to explain since the beginning uh, what this means, development means to the caregiver. And so what children should be able to do by themselves. And this made them feel more comfortable during the evaluation. And with the child, we had to establish this relationship that was about half of the evaluation, the assessment. And the point 6 was to know the tool very well. We have to read the items very carefully, because some of the items are also linked among themselves, and this makes application more fluid. And point 7 is about a knowledge of child development, because it's the tool is developed for people with different profiles, but the psychologists might have different ideas about child development or different concepts. So we had to establish clear concepts so to make sure that everybody understood the same thing. So we had to prepare the teams not only technically, but also to manage these contexts and human relationships. Thank you very much. Thank you, Kirsten, for sharing these important these important reflections about administering the tool in rural contexts. Thank you for your sincerity. These are very important remarks. Finally, it's no less important, I would like to ask you, Alexandra, to share your experience in Brazil and to what the procedure has been, what the reactions have been in families of caregivers and with this instrument, this tool.
Hola. Hi, Marta. Thank you. I'm glad there is translation into for Portuguese. It's an honor to be in this panel, to participate this moment so important. In Brazil, we had a huge work in the translation of the instruments. We had the support of experience of panelists, not only to guarantee the language, to have a clear language and an easy to understand language for the understanding by families, to use the adequate and compatible terms, because we have different regions. In Brazil, we have a diverse country, we have different expressions, regional expressions. So we wanted to minimize this diversity of expressions so that the questions would be clear in any place. We had to adjust the examples to have examples that were compatible with the Brazilian culture so that families understand these examples. And with this, we were able to guarantee a process that was resulting in an easy to understand the instrument. We identified that takers they were able to understand the questions, they were able to answer to the questions, and we didn't have, we were able to ensure that they didn't have difficulties to understand the questions. Also, we had supporting materials, videos to illustrate some of the questions, and they were welcomed by families. Families really appreciated this material, and this also facilitates the understanding. As in all the other countries, we also were very careful in the preparation of kits, and families liked them very much. This was an instrument that was very interesting, and it was very easy to implement. The families liked the items, the application of items. Now with the kit, it is a necessity for the training, for assessors to use the kit. And children, they also like the kids, the families, the administration has a very easygoing flow of work, and also the assessors. The assessors also value the process, the implementation, the app. It was very helpful. I think, as in all the other countries, this process of translating the kit and thinking about the kit in a local manner with the adaptations, as Suzanne said, we had minimum adaptations, but we were able to guarantee a good material and a good adaptation by all the families that participated in this study. Thank you.
And it was marvelous to hear you also because um, well, it's great to hear that the materials and tools were so well received by children and parents. And it was great to share this space with you and see that different regions and different cultures have welcomed this instrument. Thank you, Marta. Thank you to all panelists. It's a great pleasure and an honor to hear you. And now we go on to our second panel, which is about the experiences and reflections of different ministries of the region. This session will be moderated by Dr. Sonia Cafe, who works for PAHO OMS.
The presenters, listening to your interesting experiences. We have a panel to reflect on what we have heard and implications for implementation on country level. And so I welcome two participants to our panel from Costa Rica and Ecuador. We also had a panel member from Guyana who unfortunately is unable to join us, but I invite the participants to also share, to respond to the questions in the chat, because I only have two questions. First, I would like to welcome Dr. Arias Montero from the Child Research and Development Unit of the Technical Directorate of National Centers for Education and Nutrition and Comprehensive Child Care Centers in Costa Rica, and Dr. Andrea Molina Vera, who is the General Coordinator for Technical Innovations in Metrics and Information Analysis at the National Institute for Statistics and Consensus from Ecuador. And so the question is, you have heard these experiences from Brazil, Chile, Peru, USA, and also some global experiences. Can you tell us how that resonated with you? What do you consider? And you can respond in Spanish, in English or Portuguese. What do you consider opportunities and challenges for implementation in your countries? And I would like to ask each one of you to respond to this question, starting with Dr. Arias Montero from Costa Rica. You have 3 minutes to answer this question.
Well, good morning. Thank you very much. I'm very happy to be here. And first of all, I would like to congratulate you because it's a very valuable fact to have these scales and solid scientific evidence on early development. And it can be applied in different cultures and contexts, and this makes it very broadly applicable. And so we can do analysis or also comparison tables between the different countries or age groups. And this is a need that is being answered with this tool. And well, regarding the service provision, Costa Rica will make it available. We'll take the necessary measures. You say it's flexible and it's adaptable to different contexts. One of the challenges here is to consider not only the populations that are taken care of by a facility, a medical facility, but also the ones that do not have access to such a facility. And so we have to reach out to pregnant women and breastfeeding women and also the small children. It's very important to work with women during the mothers during the first 100 days of the child's life so that they are aware of this important tool and are willing to participate. And we also have diversity as was mentioned in the previous panel, and that it is applicable in areas with dirt floors or any area. And here we really reach out to the population directly. This is one of the valuable tools here. In this case, to face the challenges that we have and to consider different strategies to mend the situation and establish also networks. In Costa Rica, for example, we have a network on child care and other institutions that support child development, the Social Security, the Ministry of Health, the Ministry of Education, and also the academia, the universities, because this tool will strengthen the interinstitutional support. And well, I thank you very much, and it would be great to establish a coordination and a cooperation between the different sectors and to have the support of the government and to have the information, the data available in different systems. It's another very important tool. And because we are in a transition in which there is a lot of documentation on paper, and and we have to put it into the online tools, and this makes it difficult to analyze the whole country with the same indicators. I believe that this is a progress that we have achieved here, and this joint work, this will foster our working together in this. And it's also important to say that we can work with the families. The families will feel motivated to participate in these aspects in the sense that they can assume an active role in the development of their children. Good morning, everybody. Welcome to this important event from Ecuador, from the National Institute of Statistics and Population Counting. I can answer some of the questions asked by Sonia regarding the opportunities. In our country, I believe that the scenario is quite favorable because we have a series of policies for first childhood, and we also have a national poll about child nutrition that we can use, and we have used this tool twice before in 2022 and 2024 with great support of a multilateral support from different institutions, so from IDB, for example, also, and Marta Rubio, and we have UNICEF support also, the World Bank. So this poll, this tool is used for children under 5 years of age. We have a question about the family space. We ask about books or also notebooks with designs, with drawings, and the accessibility of literature for those under 15, and to books also for children under 5. And so we can monitor some indicators. For example, when children under 5 with early stimulation and the progress, physical and mental development in later childhood. And we also have a module that we have developed for the development of language. So we have the MacArthur tool that is used at 18 months, from 12 to 18 months, and also in later childhood. And we ask mothers about the questions the child asks at this age. And so we monitor the average number of words the child knows. And then we have the tests of vocabulary that is applied, to children from 43 to 59 months. And this is an indicator that provides the development age in point. And I believe that the opportunity is there in our country because it's important for the policy of first childhood is very important. These are the instruments we have right now, and we have received support and training for the members of our staff and also financial support for the modules. So this you mentioned about the GSED package that is available freely is an added value of this package in order to promote its use. I believe it's important what you recommended from previous presentations to set up pilot tests in different countries of this package. And here at Statistics Institute, Public Statistics, we are very much interested in being able to delve into these tools and experiences in order to analyze the possibilities of setting it up as a pilot. So, well, the policy of early childhood is a priority policy at public level, and it will take us some time, and we have the opportunity to analyze the best tools. We have a questionnaire that we will have also in the next years for general monitoring and for diagnosis and for the follow-up of the public policies for early childhood and priority health packages. And the poll from the National Statistic Institute is a priority tool for us because it helps us also to know about the interventions in the whole health package. And we are interested as an institution, and my area about of methodology and analysis would like to learn more about a more detailed presentation of this package that you are launching today, which I think is a very good opportunity.
Much.
Gracias.
Dr. Montero has disappeared. What if you could put your face up again so we can thank you both appropriately for sharing your initial responses to hearing all the presentations, because you highlighted both the individual benefits that you see in terms of the family, the child's development, and also from a population perspective, such as the example from Ecuador, where you do population studies and can incorporate some of these tools into your measurement, which will influence not only policy but also health services. And you both mentioned the importance of having this data for multi-sectoral action to promote and support the development of children up to 36 months of age. And so we don't have much time. I just want to thank you for sharing your initial thoughts and responses. Also, those who responded in the chat, emphasizing that these are important instruments that can be used on country level, both population level as individual level. You both indicated, and also in the chat, that there's a need for further details, learning from the pilots that were presented, supporting countries, and we are available to support you. We're very happy that you are saying these are useful instruments. And so thank you both very much. And I'm giving this then back to our moderators.
Thank you so much. Thank you so much, doctora Café. Para concluir el evento de hoy, invito al doctor James Fitzgerald a compartir unas reflexiones finales.
To conclude today's event, I invite Dr. Fitzgerald to share some word Thank you very much, Paola. Yes, I wanted to thank all the participants and colleagues for their presentations about this tool that has an direct importance for the development of the capacities of all countries, and it's oriented towards the goals of improving child development, and we hope that we will achieve the desired results. And it was very nice to get to know all the experiences from the countries that are present here, and we invite you to join this process. We are right now translating all the documents related to the implementation in the different countries. And you have, of course, the support of PAHO and the WHO and our other partners. Thank you very much again, and I wish you a very nice day. Thank you. Thank you, Dr. Fitzgerald, and thank you all our speakers and participants. And this closes our formal program. And the documents will be available for the Americas at the GC site, and we will be happy to learn how you can integrate it into your work. And thank you for contributing to the monitoring of early childhood development in the Americas. Thank you very much to the interpreters for their valuable support. Thank you. This session is now over. Thank you.